flu season is on track to be one of the worst in recent history. In terms of the number of people infected, flu is now widespread in almost every single state, and nearly 10 million people have become ill so far. 4,800 of those people have died.
It's a race to stop a deadly virus from spreading. Passengers touching down in the U.S. on flights from central China now face a medical check. Health officials at airports in New York, Los Angeles and San Francisco are testing travelers coming from the region who may have symptoms of the virus.
The flu widespread now in all 50 states. 32 children have died. Others face severe complications, including the story of one little girl. I told you about her yesterday. She's now blind.
We are taking a closer look at the rise in flu cases in Texas. State health officials say flu-related doctor visits have hit the highest point in the last decade.
It is affecting every city and region in Texas. Nobody's safe.
Flu is taking its toll on Northeast Florida.
Doctors across the area say what's going around the most is still the flu. In Clay County, urgent care centers are also seeing an influx of upper respiratory infections. This cold is difficult to avoid catching since it's an airborne sickness. Treatment for those already ailing include rest and medications to relieve symptoms.
Well, according to the Centers for Disease Control, Nebraska is the most flu-affected state in the country. And the South Sioux City Health Department confirmed the outbreak today, saying the city has been hit hard by the flu the past few weeks.
Matthew, the CDC says based on population size, Nebraska has seen more flu cases than any other state in the country. And beyond the number of people affected, Nebraska is also seeing a more serious strain of the flu.
Health experts are calling it an unusual flu season.
And the Minnesota Health Department reports seeing a big wave of flu-like illnesses a bit earlier than normal, and that's not all that's different. 167 schools around the state reported flu-like illnesses the week before winter break. That compares to 60 outbreaks the previous week. Something else that's unusual is the type of flu that's spreading. Typically, health officials will see Influenza A as the dominant strain. Now they're seeing a dominant Influenza B, which hasn't happened since the early 90s.
It was another hectic day for South Sioux City pharmacist Kayla Guy.
We've been pretty busy lately,
as the pharmacy rushes to fill a growing number of flu-related prescriptions.
I get around 15 to 20, honestly.
Walgreens tracks the amount of flu medication its pharmacies provide every week. Right now, Nebraska is at the top of its list as the #1 state for medications.
With that, we've had a lot more of the flu in the last couple weeks here.
In addition to having more cases, the strain of flu is also different. As opposed to the usual Influenza B, there's been a widespread of Influenza A, a more severe strain.
That'll normally stay with you for at least a week.
Sniffing, runny nose.
Some residents say it's become hard to avoid.
You go everywhere and people are coughing on you and sneezing on you. You can't go anywhere without being exposed to something.
Pediatric deaths are double what they were this time last year, and Dr. Tara Narula is here to help us understand why. So 32 children have died so far from the flu this year. Why is it up so much?
So it's interesting. This year, the word we use about the flu is unpredictable. And it's been unpredictable because we've seen a shift in the predominant strain, which is usually Influenza A. This year, it's Influenza B. That hasn't happened since the 1992-1993 flu season. And we know that Influenza B tends to affect children more. They tend to have a more severe reaction to Influenza B than the older
What are the more serious complications they can get?
So certainly pneumonia is one of the most serious and most frequent complications. They can also get encephalitis, which is swelling of the brain. They can also develop sinusitis or ear infections. Then there can be things like seizures or myocarditis, which is inflammation of the heart muscle.
Story about a little girl going blind.
That's right.
You have an incident in your own house.
We do. We were away.
She had the flu shot.
My daughter had the flu shot.
How old is she?
She's 7. She got the flu while we were away on Christmas break. And as she was recovering, we thought, oh, she's getting better. She came into my room at night and said, I can't walk. My legs hurt. And she was crawling to the bathroom. Wow. At which point we discovered that, in fact, viral myositis or inflammation of the muscles of the legs can happen in children who
You and your husband are doctors.
We are, and it was so scary.
Yes,
and this is why it's so important to remind parents that this doesn't have to just be, a fever and some respiratory symptoms. This can progress. This can be deadly.
So what should parents be looking for?
So certainly you want to look for signs of the flu, right? So fever, abrupt onset, cough, runny or stuffy nose, sore throat, headache, muscle aches. But also in children, they can have things like stomach pains or nausea and vomiting and diarrhea, abdominal symptoms. And then you want to recognize when things might be getting worse. So if the kid complains of muscle aches or pains, if they look like their lips or skin are turning blue, they're having respiratory difficulties, their fever's very high, or their mental state or alertness really changes, you need to seek care and call your doctor.
And as you pointed out, this thing can look like it's going away, and then it can suddenly roar back.
Exactly.
Even when they had the flu shot. That's what's so funny.
All right, Dr. Tara Narula, thanks.
Warning signs that scream, get to an emergency room now. What are they, Dr. John?
And again, we know with children that as adults, when we're sick, everybody knows we're sick. We look, we act sick. With children, they can look great, and all of a sudden, within minutes, they get sick. So here's the warning signs. Difficulty breathing, if they're coughing so much they can't breathe, if they're wheezing, if they have stridor where you can see their ribs when they're trying to breathe really hard, if they have decreased responsiveness, you know your own child. If they're not acting normally, take them to somebody. If they're dehydrated, especially if you don't notice any tears when they're crying, or they can't hold liquids down, if you notice discoloration to their lips, that's a big sign they're having problems as well. And if they have a fever above 104, have somebody take a look at them.
Okay.
Dr. John.
Thank you.
You bet.
It is statistically rare for a child to die from the flu, but that's what happened after he was brought last weekend to Oshai Children's Hospital. Our Dave McKinley spoke with the chief medical officer there today.
It's devastating anytime you have a child who passes away.
Due to health privacy laws, the chief medical officer at Oshai Children's Hospital would not discuss the specifics of the boy's case, but did say deaths from the flu among children are rare.
It is. So if you look at the 2017 to 2018 season, there was, I think, 100 and some odd children that passed away from the flu across the country. So if you think about the millions of children that we have across the country and the millions that actually get the flu, that's a very, very small percentage.
The Erie County Health Commissioner, who confirmed the child's death was due to complications from the flu, said the same, noting it's just the second childhood death from influenza in Erie County in 15 years, and the second of the current flu season statewide. Meanwhile,
we're seeing much more flu this season compared to other years.
Nearly 2,000 people statewide were hospitalized with the flu last week alone, which was up 34% from the prior week. An indication flu season is in full swing.
That's why we have to be, so vigilant about doing everything that we can to protect our kids, to protect ourselves and the people around us.
In a statement, the Frontier Central School District identifies the boy who died from flu complications as 11-year-old Luca Kalani of Hamburg and describes him as a wonderful young man who positively impacted all of those around him. And there's been a Facebook page created to memorialize Luca, asking folks to light orange porch lights in his memory for the next 2 weeks. Some might be wondering if Luca got a flu shot. Dr. Turkovich, again bound by privacy laws, cannot state that either way. And while Dr. Burstein says there's no such thing as a typical flu season, Dr. Turkovich says there is a discernible difference this year in that the B strain of the influenza is showing up earlier in the season than what was expected, although he says there's no definitive evidence that one strain, the A or the B, is any worse than the other.
State epidemiologist Tom Haupt says flu hit the first child to die extremely fast.
Child became very sick very quickly and passed away on the way to the hospital.
The state says flu has landed nearly 100 people in intensive care, and 60% of admissions have been for people under 65, unlike recent flu seasons.
And some of the children have required hospitalization actually for dehydration and complications related to it.
Parents are urged to seek medical help quickly if symptoms become worse.
So with the flu, usually you come in with really high fevers that happen really quickly. General body aches, you just feel really sick. Sometimes you're so sick that you can't really drink or eat anything.
More than 30 kids have died across the nation. Terry, what else do the numbers show?
Wisconsin's flu surveillance report came out late this afternoon, Patrick. Beyond a child dying here in southeast Wisconsin, there's another concern. State health officials say they don't think flu season has peaked yet.
Taiwan is on high alert over a mysterious viral pneumonia that struck a Chinese city and infected 59 people so far. Taiwan Centers for Disease Control has issued a travel advisory ahead of the Lunar New Year holiday. Also on Tuesday, the Taiwan CDC said the domestic influenza outbreak was in its peak period. Last week, 113,000 people were treated for flu-like symptoms. 2 people died from flu complications.
The new coronavirus first appeared in the city of Wuhan in central China. Medical workers spotted a cluster of cases of a new type of pneumonia. Patients had fever, coughs, and breathing problems. So far, only people who visited or lived in Wuhan developed the virus. But as people travel overseas during the Chinese New Year holidays, more cases have been detected.
This is such a scary story for parents. This little girl was perfectly healthy until she got the flu.
I didn't think I was going to see her again.
This morning, a mother's urgent warning about the flu after unexpected complications from the virus left her 4-year-old daughter unable to see.
Here, listen.
Amanda Phillips says her daughter Jade, who did not get a flu shot this season, started showing signs of being sick a few days before Christmas.
She was, just a normal bug, the flu, for a couple days, and all of a sudden, 5 days later, she was unresponsive.
When her parents found Jade unresponsive on Christmas Eve, they rushed her to the hospital, where she was diagnosed with Influenza B and acute necrotizing encephalopathy.
There's an initial infection with influenza, and then the body sort of overcompensates when it is fighting the infection, and sometimes, instead of fighting off the infection, it starts fighting itself, and in this case, it can fight the brain.
After nearly 2 weeks,
hey,
Jade finally opened her eyes, but Phillips says she noticed something wasn't right.
She couldn't focus. You would hand her something or try to, give her a toy and she wouldn't grab it.
You find it a bit hard to see.
Her mom says she's lost her vision and is not sure she will ever get it back. Still, she and the doctors remain hopeful.
When it happens in younger children, can recover significantly, and we definitely have hope in this case that there will be significant recovery, but there can be permanent outcomes from this process.
Now, back at home, Jade is making progress, but still has a long road ahead.
And Phillips says Jade didn't get a flu shot last March during a routine pediatrician visit, and that she thought that meant she was good for the whole year. She didn't realize she needed a new vaccine for the 2019-2020 season. Good reminder for parents.
But even if you do get the flu shot, there are no guarantees, but there are some additional benefits.
Yeah, it helps keep these kinds of extreme complications from happening. It helps you, they think in some ways, theorize that it could help you fight the flu as well.
Oh, helps she makes a full recovery and gets her sight back. Thanks, Eva.
In West Texas, this teacher is doing a deep clean of her classroom.
Most of them touch here.
School districts statewide in scrub mode, hoping to keep kids in the classroom amid the flu outbreak.
Those flu viruses can live for a long time on those surfaces, so it's good to get them a good cleaning.
Doctors urge Texans to keep up the hand washing, covering coughs, and staying home from work or school if you've got symptoms. And this year, a new idea. Emerging research suggests humidity, which is normally around 50% in your home, can play a role in the spread of viruses. The humidity is often lower inside during winter months to avoid condensation, but this new research shows lower humidity may reduce our immune system's ability to fight viruses.
What we're hoping, though, is that this is truly the peak of flu season and that it doesn't continue to rise or stay high for a very long time.